Hello all, and thank you so much for your interest in PharmaLedger and this presentation. My name is Halid Kayhan. I am a research associate at KU Center for IT and IP Law in Belgium, and also a co-lead for regulatory, legal, and data privacy framework for PharmaLedger project. So in this presentation, I will give you a short introduction to PharmaLedger project and also briefly explain how we are using blockchain to enhance privacy. And this is particularly important because for many people, privacy and blockchain are kind of oxymoron. So they are in conflict with each other in nature. However, we are not in this idea, and I'll be very happy to share how we are designing our project for this purpose. So first of all, the PharmaLedger project is a 3 years long research project which started at the beginning of 2022 and will end at the end of 2022. And this is a project to establish a blockchain-based platform proven through reference use cases in 3 focus areas: supply chain, clinical trials, and health data. And we are actually a consortium of 29 partners, of which 12 partners are pharmaceutical companies, and we have 17 partners from public institutions, including hospitals, universities, research centers, public bodies, patient organizations, and in total we are working with a budget of 22 million, gathering together both private and public funds. And actually, I would like to also give you a short overview, a quick overview of our partners and where they are based. Actually, as you can see, we are among us there are pharma companies, SMEs, research centers, hospitals, among others. So I'll be happy to tell you about the objective. And the main objective of this project is to develop a scalable, sustainable, beyond state-of-art blockchain reference architecture, validating different use cases from different healthcare domains. And this is about patients' empowerment, supply chain transparency, and clinical trial efficiency. The main objective is multifold, as you can see, and which means that we are also working for integrated health data marketplace, and a collaborative platform, more security of information and greater access across use cases, agile secure delivery of innovative applications, among others. So now you see the organization. Our organization seen for the moment, actually. So as you can see, this is actually I should tell you something in the beginning. As you can see, this is an innovative medicines initiative, and this is the innovative medicines initiative is a joint undertaking of EU and European Federation for pharmaceutical industries and associations. And this IMI, this initiative is to provide the grants for innovations in medicines and healthcare, particularly in the cases where innovation is too risky for one stakeholder or just a few stakeholders. So IMI is just gathering together different stakeholders to innovate for the public interest, for the public health. And so as I told you, this is a project under IMI, and we have a project management board composed of Novartis and Polytechnic University of Madrid, and under that, in our steering committee, we are working in different work packages. So as you can see here, each work package is on different part of the project, and each of them is directed by one private partner and one public partner. And as I told you, I am the co-lead for Work Package 5, Regulatory, Legal, and Data Privacy Framework, and we are also ethical and legal manager of the project, working in close collaboration with ethics board, which includes both external and internal experts. But this is completely different from external expert advisory board, which provides more general advices to project management board, and through that the steering committee. And now you can see the multi-layer platform of PharmaLedger, and as you can see, the layers include the blockchain layer and open data sharing units layer, web APIs layer, and applications layer. So I'll briefly talk about use cases in a moment, but and then this will make more sense in my opinion. But briefly, this multi-layer platform brings us some very important advantages, including the possibility to use different blockchain technologies for different use cases, and the interoperability between different use cases, and the opportunity to use OpenDSUs, which is a model to store data, personal data off-chain, and not on the blockchain itself. And these are all very important in our opinion, and the use cases will not be limited to what we are trying to build right now, but any possible use case in the future that can be produced and integrated in this platform or based on this platform. And this is the list of the use cases, selected use cases, which we are working on right now. As you can see, for different domains, namely health data, clinical trials, and supply chain, we have different use cases. And I should note that these use cases have been selected among over 100 use cases. So, and since more than 1.5 years, we are working on these use cases actually. At the end, actually, when we reach our goal, the blockchain-enabled healthcare, then it will be definitely possible to use other use cases based on this platform. And this is a very good overview of the different use cases. And but unfortunately, due to the limited time, I will not be able to go into the details here. But as you can see, they are well connected to each other, and then they present a very important value chain for healthcare. And this is where we are right now. Actually, we are in the last quarter of the second year. And as I told you, this project will end at the end of the December 2022. And in this quarter, we are mainly dealing with platform sustainability planning and continuous platform enhancement. And now I'll be happy to briefly talk about the work package that I'm leading. And actually, the work package is a legal, ethical, and regulatory framework for PharmaLedger. And actually, the objective is threefold. So the first one is to provide legal, ethical, and regulatory framework by analyzing legislation, case law, and doctrine applicable to blockchains and healthcare and PharmaLedger project in general. And then the second one is assessing the ethical and legal implications of PharmaLedger solutions. And lastly, we will provide recommendations to law and policymakers for improving the regulatory framework. But of course, to do this, we will also identify the shortcomings and open questions in the regulatory frameworks. And to do this, we are focusing on EU data protection and privacy legislation, as well as legal and regulatory frameworks for clinical trials and pharmaceutical supply chain. And our special attention is paid to EU data protection and privacy legislation because, as I told you in the beginning, blockchain is a bit the EU data protection law and its relationship with blockchain is a bit complicated. And I should also note that I am using data protection and privacy interchangeably in this presentation, although they are used differently in the EU. But since both terms are used for the same purpose in different jurisdictions, I believe it will make sense to use them interchangeably for the purpose of this presentation. And now you can see what we are doing in this work package. So we already delivered 2 reports, and the first one, which was delivered in September 2022, provided the ethical and legal framework applicable to PharmaLedger project actually. And this was not this was just to identify point out the legal and ethical and also regulatory frameworks that should be taken into account while creating the PharmaLedger platform. But also in May this year, we provided another deliverable, which was in-depth ethical and legal study, which provided the detailed guidance for the PharmaLedger platform from legal, ethical, and regulatory perspective. And we also provide some recommendations on how to better comply with the related frameworks as PharmaLedger platform. And lastly, at the end of the project, we will provide another deliverable, and this will assess whether ethical and legal requirements that have been identified so far have been adequately implemented, and also what can be the recommendations for law and policymakers for the identified open questions and shortcomings in the regulatory framework. And now, so actually, as I told you, the blockchain and privacy relationship is at the core of this project, because we believe that blockchain can provide various advantages to healthcare. And actually, this is not only our idea, but this is already something that is being more and more used by even the EU itself. However, it is still questionable. The relationship between blockchain and the GDPR is still a bit a hot topic, and I will briefly tell you why it is the case. So first of all, blockchain is a shared and synchronized database maintained by a consensus algorithm. Very briefly, so and what does it mean? So actually, it means that the data is not stored in one not under the control of one central agency, but by different computers over a network. So, and the ledger, the full copies of ledger is stored by different computers, which makes it decentralized. And the decentralized nature is going against the idea behind the GDPR, which assumed that there would always be one central agency to assume the responsibility for compliance. But this is not the case for the blockchain. But I will just explain the but in a moment. But on the other hand, there is another important feature of blockchain, which is immutability, or patent-only feature of the blockchain, which means that it is extremely difficult to change or destroy a data that is already been written, on blockchain. And actually, this also raises some concerns about certain data, certain privacy principles like data minimization, and also some concerns about data subject rights like right to erasure. And while we are experiencing these, while we are hearing these concerns, we still don't have a regulatory guidance on how to implement GDPR on blockchain solutions. However, we believe that PharmaLedger will provide a blueprint to use blockchain, especially in healthcare, to achieve the purpose of the GDPR. First of all, I should explain the bot that I just referred a moment ago. So the blockchain technology is not a one type technology. Actually, it's a class of technologies, and there is not only one way to design it. And this is why we think that it makes much more sense to focus on how we can take the most benefit of the different ways to design it and its unique features. And actually, in our opinion, we are on the right way to use it to improve accountability, data subjects control over their data integrity and security, as well as trust. And I will now explain you how we are doing this. So first of all, we are, as you can see, we have a cycle on the left-hand side. So this is summarizing the privacy by design principles, actually. And privacy by design, or data protection by design, is a very important principle of data protection and privacy, and also it is included as a very important principle in the GDPR itself as well. And what it means? So actually, it means that we are putting all the necessary technical, organizational, and legal measures in place to ensure compliance and the enforceability of data subject rights at the very early stage of the designing of the platform. And this is not a one-off practice, but instead this is a continuous practice, which means that each step leads to the other step, and this will be done for the lifetime of the project. I'm not talking about the research project for 2 years, but also the post project, because we have a sustainability goal while building this project beyond the 3 years. And with regards to how we are managing it, how we are enhancing privacy with blockchain, we are using, first of all, hash values for blockchain anchoring. So, which means that we are not putting any data on blockchain itself in a visible, open way, but we are always using hash algorithms to use and transform the data into unintelligible, and random-looking digits and letters, actually. And this makes the pseudonymization is built in the technology itself. So then we are also using open DSUs, open data sharing units, which is storing, which provides the opportunity to store all the person data off chain instead of blockchain. And this is a very important issue to solve the issues raised by blockchain skeptics. And as I mentioned you previously, all the issues regarding the concerns about blockchain and privacy. And then the open DSUs will be managed by data subjects themselves, and this will make the personal data under the control of data subjects themselves. So this is one of the most important issues in our perspective while designing this project. And on the other hand, I should note that we are encrypting personal data, although it is not on the blockchain itself. We are still encrypting it both in transit and at rest. And we are also working on a governance model right now for the sustainability of the project after the December 2022, which will be the end of our research project. And this governance model will identify the roles and responsibilities of different stakeholders included in data processing. And this will also solve the issue of the question regarding who will be the data controller, who will be the responsible stakeholder, responsible one to comply with the data subject requests or regulatory authorities requests or requirements. And actually this is something which we are working very, very hard, very much, I can say. So furthermore, we are paying special attention to certain rights of data subjects because, as I told you, this is also one of the main concerns of blockchain skeptics. And for example, right to erasure is one of them. Right to erasure is maybe the most prominent of them. And for this, actually, we are planning to break the linkage between off-chain data and the hash values on the blockchain, which will make these values actually valueless because they will not be possible to make it connected to another data previously stored off-chain. And lastly, I will mention you the self-sovereign identities vision of PharmaLedger project. So we have an identity management task force to create the models for self-sovereign identities for each use cases. And self-sovereign identities is the model to make the data subjects or the individuals the owner of their identities. So for now, we are actually relying on the intermediaries which are providing us digital identities. But then this will not be the case. The sole owner of the digital identities, the self-sovereign identities, will be individuals themselves. And it will be possible to attribute some claims to these identities. Then verifying these claims, these attributes will be possible with zero knowledge proofs and also abstract verifiable claims, actually. And what I mean by doing this, what I mean by saying this actually is you will be able to anyone will be able to verify your if you are over 18 years old without knowing your date of birth. If you grant them access, if you grant them the right to know that. I mean, not talking about the birth of date, but age over 18 or not attribute actually. And so this will improve the anonymity. And on the other hand, it will be possible to limit attributes in verifiable claims to the absolute minimum necessary. For example, as I said, it will not be needed for you to share the data birth of date, but just whether you are over 18 or not. And this will uphold the data minimization principle. And as another very important principle of privacy, data security, it will also be upheld because it will be possible to exchange verifiable claims off-chain via encrypted channels with these self-sovereign identities. And by saying this, actually, I would like to note that you can, of course, find much more information and also the latest developments by following us. So don't hesitate to follow us. We'll be very happy to get in contact with you if you are interested in this project. And on behalf of the PharmaLedger platform, I would like to thank you so much for your interest and attention.